Good morning, good afternoon, or good evening, depending on where you are. Welcome. This is the International Society for Behavior, Nutrition, and Physical Activity webinars for 2017. I'm Maureen Ash, and I'm on faculty at the University of British Columbia here in Vancouver, Canada. This webinar will last for about 75 minutes. And I want to just mention that they're being organized through our special interest group. And I would certainly encourage you to go on to the ISBNPA webinar website to have a look at the different special interest groups. There are other webinars and recordings available, and again, these are on the website. I want to make particular note of the aging SIG, and there's some information there looking at what the goals are. And the two leads for this are Paul Gardner from Queensland, Australia, and Seb Chaston, who's from Scotland. And Seb is actually going to be a panelist at the end of the presentation in case you have some questions specific about the aging SIG. Just a reminder, if you do want to ask a question, first of all, the questions will be answered at the end of the presentation, but please use the question and answer feature of Zoom in order to ask your question, and then what we'll do is we'll go through and moderate the questions at the end for the presenter, Callum. So without further ado, I'd like to present Mr. Callum Leask. From Glasgow Caledonian University, and he's going to be presenting today on utilizing participatory methodologies for aging research. Callum, take it away. Thank you.
Right, well, hello everyone. Good morning, good afternoon, good evening, wherever you are. And thank you very much for joining me today. Before I start, there are a few people I would like to thank. First of all, I need to thank ISBNPA for giving me the opportunity to talk to you all today. I'd also like to thank Antonio for setting this up. I'd like to thank Maureen for moderating this webinar, and also special thanks go to the two co-chairs of the Aging Special Interest Group, who are Seb Chaston and Paul Gardner. So you'll see in the top right hand of the screen, you can find my Twitter handle is @Callum_Leask. So if you enjoy my presentation today and you'd like some more information, then be sure to follow me there. So a little bit of information about who I am. I'm a PhD student at Glasgow Caledonian University, and my project is looking to co-create public health interventions with a specific focus on principles and recommendations to guide the process. I'm also a research associate on the Seniors USP, which is Understanding Sedentary Patterns project, and my special research interests are co-creation and active aging. So the aims of my presentations today, I'm first of all going to talk to you a little bit about what participatory methodologies actually are and what is the need to use them. We're going to discuss how we can apply participatory methodologies at both a local and population level. And then we'll have a little bit of discussion about how we can actively engage non-academic stakeholders in aging research. Now, for the purpose of this presentation, we will define aging in line with the World Health Organization's Global Strategy and Action Plan on Aging and Health, which specifically states that healthy aging is relevant for everybody. So rather than a specific focus on older adults, this is going to be very much a life course approach. First of all, I would like to start with a bit of a rationale as to my webinar today. We have an increasing pressure on society to deal with a rising chronic disease burden and aging population. Now, the majority of this disease burden is due to modifiable risk factors, things like smoking, poor nutrition, and inactivity. So as predominantly health researchers, it's our job to develop interventions to try and positively influence these health behaviors. And what we find is that in very controlled laboratory settings, we're quite effective at showing positive change on the health behaviors that we're targeting. However, when we translate this evidence and develop interventions into a real world or population level setting, something seems to fall down and something seems to not work, and therefore we have some research which is really lost in translation. Now, one of the reasons for this may be the fact that the health behaviours that we're targeting, so smoking, inactivity, and poor nutrition, are what we can define as wicked problems, which are resistant to top-down theories. Now, I'm going to exemplify sedentary behaviour as one of these wicked problems to characterise what wicked problems actually are. So I do not expect you all to read this slide, and this slide is simply to emphasise that wicked problems such as sedentary behaviour are very complex. So for example, we have over 150 determinants of sedentary behaviour, and what's more than this is that all of these determinants actually interact with each other in different ways. We also know that wicked problems have a large variance between individuals and settings. So this is some work by Juliet Harvey. If we continue the sedentary behaviour wicked problem, which shows that older adults can sit from anything for less than 3 hours per day to over 11 hours per day. So due to this large variance between individuals and settings and the complexity of wicked problems, there's a clear rationale to develop more tailored solutions and more tailored interventions to individuals' contexts and needs. And one increasingly advocated way to achieve this is to engage non-academic stakeholders in the research process. Now, this is being increasingly advocated by funding and governing bodies, so for example, Health Canada and the National Cancer Institute, as a more effective way to achieve positive change at the societal level. And typically when we think about how we can engage non-academic stakeholders in the research process, there are really two phases we could think about. The first is the implementation phase, where non-academics are engaged in how to implement a pre-existing intervention. Or we have the design phase, which is what I'm going to mostly talk about today, which is involving non-academic stakeholders throughout the research process, from defining the problem that we're trying to target right the way through to testing the effectiveness of solutions. Now that I've given you a little bit of a rationale about my webinar, I'm going to begin by talking about what participatory methodologies actually are. In the simplest form, participatory methodologies are about planning and conducting research with the people under study. And this is a bit of a change from what is traditionally done in health research, which is research on the participatory group that we're trying to target. What's also interesting is that in the literature, there are many different conflicting umbrella terms to describe a multitude of ways to plan and conduct research with non-academic stakeholders. These include, but are not limited to, participatory methodologies, participatory approaches, action research, and participatory research. But for the purpose of this webinar today, we will use the term participatory methodologies as our umbrella term, as we are specifically utilising these methodologies to advance ageing research. Now I would like to give you some examples of participatory methodologies in use and when we might use them. So this is a really nice table by Gay and colleagues in Reflective Practitioner, where they give some distinguishing questions that help differ different types of participatory methodologies. So the oldest and most commonly used is action research. And one example of a key research question for action research is, what is the practical problem I need to address in my work? So this is commonly used in educational reform to improve teaching practice. We have a second generation of action research called participatory action research. And an example of a key research question for this is, what can we do together to change the situation here? So the example I'm providing is work by Frasler and colleagues who use participatory action research with local policymakers and professionals for physical activity promotion with women in difficult life situations. And another participatory methodology, and the one that I am most familiar with, is participatory and appreciative action and reflection. And an example of a key research question for this methodology is, what are our successes and how can we amplify them to build and sustain a better future from valued aspects of the positive present? So here I held a series of co-creation workshops with 11 community dwelling older adults to co-create an intervention, a tailored intervention, to reduce sedentary behaviour in that population. Recently, there has been a large movement from the social sciences literature called participatory health research, which was created to unite the rigor of a wide variety of participatory methodologies. Now, the key construct of participatory health research is generating localized knowledge to try and positively influence localized problems. Now, whilst participatory health research it situates itself as a research paradigm, and this is very useful for generating localized knowledge, there are current constructs that it does not currently consider for intervention research. So these include things like formally testing the effectiveness of solutions to understand whether they do actually positively influence health behaviors or not. Also, principles for scaling localized solutions to tackle public health issues at a large scale, and also governance guidelines, so delineating principles and recommendations about how to effectively engage non-academic stakeholders in the research process. Now that we know a little bit about what participatory methodologies are, let's talk a little bit about why we actually need to use them. Well, one of the advantages of using participatory methodologies is that we can actually improve tailoring of interventions. So in the Medical Research Council's new guidance on developing and evaluating complex interventions, they specifically state that we should involve stakeholders in the choice of question and design of the research to ensure relevance. So engaging stakeholders in designing research can actually improve the tailoring and ensure local relevance. Secondly, using participatory methodologies may improve effectiveness versus one-size-fits-all approaches. So this is a systematic review and meta-analysis by Durand and colleagues, who concluded that shared decision-making interventions significantly improve outcomes for disadvantaged patients. And this includes things like increasing patient knowledge, increased informed choice, and decreased conflict. There's also evidence to suggest that using participatory methodologies can lead to a higher quality of service provision. So again, we have another systematic review by Crawford and colleagues who showed effects of involving patients in the planning and delivery of healthcare. And we see here that there's evidence to support more accessible healthcare services, increased patient knowledge, and higher patient satisfaction if patients are actually involved in the planning and delivery of healthcare programs. However, I would like to draw your attention to this blue box, whereby there was no evidence of increased use of services, increased satisfaction amongst patients, and also improved health or quality of life for patients. However, as the authors concluded, and this is a point that I would like to make quite strongly, this absence of evidence should not be mistaken for an absence of effect. So what are some of the challenges of using participatory methodologies? Well, if we go back to the systematic review by Crawford and colleagues, we see here that there is no quantitative research evidence of any positive outcomes from engaging non-academic stakeholders in the research process. So really, we don't know if engaging patients or any other non-academic stakeholder is effective or not. And if we fast forward 14 years to a recent co-creation literature review by Tricia Greenhall and colleagues in 2016, the authors concluded that current end-user engagement models, so things like community-based participatory research and value co-creation, so far have contributed little to the science of research. So for example, how research is assessed and evaluated. So we still have very little evidence showing that engaging non-academic stakeholders in the research process is effective. Indeed, when we engage non-academic stakeholders in the research process, this hasn't always been shown to be successful. So some work by Antonio and our colleagues in Ghent University concluded that participatory designed digital games for healthy lifestyle promotion were actually less effective than those designed by expert games designers. So why is this? Well, as the authors of that systematic review discussed, and it's something that I've noticed, in the literature it's very, very difficult to find detailed information about governance, about upskilling non-academic stakeholders, and about encouraging them, which combined leads to informed decision making, which can therefore lead to improved outcomes. And indeed, there has been very limited attention paid to participatory governance about how to actually effectively engage non-academic stakeholders in the research process, and suggestions have been made that details and principles should really be made to help guide this collective research process. There is also participatory methodologies have come under scrutiny from Cook and Kothari, who define research processes as the tyranny of participation. So, for example, authors write about the tyranny of the group, and they state that the nature of group dynamics may lead to outcomes that simply bolster the interest of academic researchers. There's also a danger that academics are simply engaging non-academic stakeholders in the research process to boost social desirability, and the engagement of non-academic stakeholders is simply tokenism and not informed participation. And I'd like to highlight this point, and this is a figure that I've adapted from Cornwall's types of participation. And we see here that participation can range from co-option, whereby the population being studied are token representatives of that group and have no power or input in the process, right up to collective action, which is without academic research or facilitation. There is a local group and they develop and conduct their own research agenda. Now, the most common form of participation when non-academic stakeholders are engaged in the research process is actually consultation, whereby outside research perform all the tasks, but local attitudes are sought prior to this. So indeed, it still appears that there is a disassociation between how engaged non-academic stakeholders actually are in the process versus how engaged the academic stakeholders think they are. And there's another issue in terms of scalability. So as I mentioned before, most participatory methodologies really result in developing localized solutions to localized problems. But as the majority of us are public health researchers or intervention researchers, we want to try and tackle public health issues on a very large scale. So there's an issue here about how do we actually scale these localized solutions and very tailored solutions to derive population level inference. So now that we've spoken about what participatory methodologies actually are and what is the need and some of the challenges about using them, how can we actively engage non-academic stakeholders in aging research? And for this section of the webinar, I would like to lean on some work that I've conducted with my fantastic colleagues at Glasgow Caledonian University, at Umeå University in Sweden, Ghent University in Belgium, and BU University in Amsterdam, where we have delineated principles and recommendations for utilizing participatory methodologies in the co-creation and evaluation of public health interventions. Now, whilst these principles and recommendations are for co-creation, most of the principles and recommendations that I will talk about are very important for any instigator of research projects that wishes to effectively engage non-academic stakeholders in the research. So for this manuscript, which is currently under review, we drew on 4 case studies that we've conducted in each of our institutions. So as you'll see in this table, our case studies have used a variety of different participatory methodologies. We've targeted a wide range of health behaviours across the movement spectrum, from physical activity to sensory behaviour. Our target population has also been across the life course, so from school-aged children to older adults. And the purpose of our research has ranged from exploring determinants of a health behaviour to intervention development itself. So following an iterative reflection process, the authorship team agreed 5 key principles that can help inform engaging non-academic stakeholders in the research process. These are Principle 1, framing the aim of the study. Principle 2, identifying the appropriate sampling strategy. Principle 3, manifesting ownership. Principle 4, defining the procedure. And Principle 5, which is evaluation and is split into 2 parts. So Part A, evaluation of the process itself, and Part B, evaluation of the effectiveness of the outcome. So Principle 1, framing the aim of the study. So for this, we were inspired by the PICO framework, which is used to guide systematic reviews. And we have come up with the Producers framework, which can be used to help guide the engagement of non-academic stakeholders in the research process. So Producers is broke down into the problem. So what is the reason for the process? The objective, so what is the aim of the process? The design, so which specific participatory methodology will be used to inform the process? The end user group, so who will use the developed solution? The co-creators, so this is to think about who will actually engage in the research process. Evaluation, how do we actually go about measuring success? And scalability, so how can the solution be scaled to a population level? And we'll see here in this table that I've given an example of the Producers framework in action, whereby I have reflected on the case study that I conducted here at Glasgow Caledonian University. So with the grandstand research group, we see here that the problem was that older adults spend too long in sedentary behaviour. So the objective was to design a tailored intervention to help older adults reduce prolonged periods of sitting. This process was informed by a participatory appreciative action and reflection methodology, and the end user group were community dwelling older adults over the age of 65. The co-creation group consisted of 4 academic researchers and 11 community dwelling older adults. You see at the bottom we evaluated the process, and also the scalability model that we use is a generalizable model, which I will go on to explain a little bit later. So principle 2, identifying the appropriate sampling strategy. Now, sampling, the purpose of which is really twofold. Firstly, is to ensure a representative sample of the non-academic stakeholders so that the outcome can be utilised by the target end user group. And secondly, to ensure that there's appropriate representation of the required expertise from all stakeholder groups. So this table here gives an example of some of the different stakeholder groups that could actually be involved in this collaborative research process. So we have end users, and this is simply the group of people or population that's the target of the intervention. So if we take this example in the top right-hand corner, if we're developing an intervention for school-age children, then the end user group is school children. We also have another group which can generally be defined as stakeholders, and that is the group of people who are interested or involved in the implementation of the intervention, but who may or may not be the end users. So following this example, this could be school children, their parents, teachers, school directors, so on. We also have academic researchers, and these are the individuals who, in a traditional public health model, will conduct the research. So this includes university researchers and also public health practitioners. And then we have the co-creators, who are the group of people that are actively involved in the development of the intervention. So anyone, school children, academic researchers, parents, and so on. When we think about our approaches to sampling, we should really think about it in 2 ways. The first is the end user group, and this is a static approach to sampling, as the end user group that we're looking to recruit during this research process, we should always strive to make them representative of the target end user group. However, the additional stakeholder groups may be dynamic, and this may change over time depending on the needs of the end users and depending on how the process goes. So we have in this table here 4 different approaches to sampling. So we have opportunistic sampling, which is, as I just described, recruiting additional stakeholders throughout the research process dependent on the needs of the end users. We have convenience sampling, which is commonly adopted when using participatory methodologies. And the benefit of this is that it's valuable to ensure that the non-academics are actually committed to the research process. We also have purposeful sampling, which can ensure that relevant stakeholder groups are actually as representative a sample as possible. And then we also have maximum variation sampling, which is recruiting stakeholders who cover a spectrum of perspectives and characteristics of interest, including typical and extreme cases. How many people should we recruit? What should be our sample size? Well, there's no hard, fast answers with this. It really depends on the purpose of the process, how long it takes, and the number of stakeholders that are actually required. So again, I'm going to lean on 3 of the 4 case studies that we conducted in our paper to show you some different examples. So we'll see in cases 1 and 2, where the target end user group was older adults, the sample size was quite similar, around 9 to 11 older adults per group, with around 4 to 5 academic researchers per group. Whereas if we look at case study 4, which focused on school children, they had less end users per group, so 6 children per group, and only 1 academic researcher. So again, it just really depends on the end user group that you're targeting and the expertise necessary. Principle 3, manifesting ownership. So the Oxford English Dictionary defines ownership as the state, right, or act of possessing something. Now, throughout the spectrum of participating methodologies, ownership has been defined as key to the process, but also very underrepresented. And this is why we've decided to make some recommendations about how to ensure it's manifested. And some of the benefits of feeling ownership within the research group: it can help improve creativity, it can help improve practice, and it can also improve knowledge production as well. So in line with this definition, let's give some recommendations. The state of ownership. This can be achieved by branding the group. So if we take my example of the Grandstand Research Group in Glasgow Caledonian University, I created and branded this group with this logo. And at our first research group meeting, all the members of the group were provided with a goodie bag, which included things like t-shirts, lab books, pens, and bags, all with the group branding on it. And this was thought to help increase the cohesiveness of engagement in the process. The right of ownership. So all stakeholders have the right to have a collective definition of the research priorities. So what are we actually trying to achieve from engaging in this research process? They also have the right to knowledge of the current evidence base, particularly on the health behaviour that we are targeting. And they also have the right to trust from academic stakeholders to have informed and meaningful input into the research. Once an individual has a perceived state and right of ownership, then it's their responsibility to act on that. And this will predominantly occur through self-investment, whereby all stakeholders will be required to input their opinions and perspectives throughout the research process to make it fruitful. Principle number 4, defining the procedure. So we decided to delineate the procedure into 2 sections. We have procedural components and we have procedural methods. Let's begin by talking about some procedural components. And I would like you to note that these are not necessarily sequential or mandatory, but they may help facilitate the research process. So one procedural component is highlighting the rules of participation. Now this links closely to the principle about manifesting ownership, which I've just spoken about. So some of the rules that need to be delineated are each stakeholder has the right to control over the process. They have the right to intimate knowledge about the problem that we're trying to address, but they also have the responsibility to invest themselves and invest their time. Another procedural component that's particularly important is upskilling stakeholders. In traditional research, the academic researcher can commonly be viewed as the expert, whereas the end user group are simply tokenist participants in the research process. However, if we want to effectively engage non-academic stakeholders, then we appreciate that this process doesn't work like this. So if we take an example of developing an extra game for children, there may be 3 stakeholder groups that engage in this process, each with their own expertise to bring to the table. So for example, the academic researchers, they will bring expertise regarding the health problems and behaviour change techniques. We have the end user group, who are children. They will bring their expertise regarding their needs and their preferences. And then we may have game designers as well, and they will bring their expertise regarding gameplay techniques. So we see that all of these stakeholder groups will share their expertise with each other, and we will have this knowledge exchange whereby each stakeholder group is upskilled by the others, and this will help facilitate creativity during discussions. Another procedural component is prototyping or pilot testing, whereby a conceptual product is produced based on gathered information. Now, this is useful to help visualize the thoughts of the research group and also enhance the final outcome. So if we are able to develop a prototype very early of what we think we are looking to develop, this can help understand what needs improved and what's good, and this will help refine the final outcome. Final procedural component that I would like to talk about is the fact that this is an iterative process. So we may think that the research process is very linear and involves 3 simple phases of defining the purpose of the research, conducting the research, and then getting results. But in reality, particularly when engaging non-academic stakeholders, it doesn't work like this. Instead, what it actually is an iterative process which involves multiple phases of planning, conducting, reflecting, and evaluating the research process itself. So some iterative procedures may include revisiting the findings from previous meetings, reviewing certain discussion points which continually come up as important, and also developing and refining the prototype itself. So continually refining the prototype, making it better, making it more effective. Now that we've spoken a little bit about some procedural components, let's talk about some procedural methods. Again, not necessarily sequential or mandatory, but something to help guide the process. The first procedural method is the structure. So how long will this process last for? Well, we have literature from the social campaigns and learning literature, which recommends that this process could last between 3 to 4 days. Drawing on the case studies in the manuscript which I referred to previously, we see here that cases 1 and 2, where the target end user group were older adults, the structure was quite similar. So around 10 workshops. Workshops are lasting around 2 hours and taking between a 9 to 13 month period. Whereas by comparison, in case 4, which worked with school children, they had much less workshops, so around 5 to 7 per group, and the workshops lasted for a shorter period of time, namely 1 to 1.5 hours, because discussions were bound by the lunch break. However, there were also informal Facebook and WhatsApp communication, so communication between the research group does not have to be limited to official group meetings. All meetings should have a flexible structure, so not to curtail the creativity of the non-academic stakeholders. However, all discussions should be informed by the producer's framework to help guide the process and ensure that all discussions are in keeping with the purpose of the process. Now I'd like to give you some examples of interactive techniques that can be used during the meetings. The first and most obvious example is brainstorming. So this is when we combine a spontaneous list of ideas to help develop a solution to a problem. Now this will be particularly important when engaging non-academic stakeholders, as quite often they will have new, novel and innovative ideas that the academic stakeholders may not have had otherwise. Other examples of interactive techniques that can be used include scenarios. So this is when we identify the needs of the end user in different contexts by developing situations that may be problematic when addressing the purpose of the research. So again, I will lean on case study 1. The purpose was to reduce sensory behavior in older adults. And one of the research activities that we had was providing the non-academic stakeholders with sitting in different contexts. So for example, sitting watching TV, sitting in a waiting room, and sitting whilst traveling, and getting them to think about, is it going to be possible to break up sitting in these contexts? If so, how, and how is it going to differ? We also have another interactive technique called personas, and this really focuses on the end user and the qualities and preferences they possess, which should be considered when developing an intervention. Now that we've spoken a little bit about interactive techniques that can be used during the meeting, let's talk about some fieldwork tasks that can be used outside the meeting. Maybe not anything quite as adventurous as this, but again, something for you to think about. So in this table, I have some examples of fieldwork tasks that can be used. The first one of which is field testing the prototype, which is when we provide stakeholders with an example of what the final intervention may look like. This allows for the prototype to be used in the typical real-world setting and helps identify how it can be improved, and this will actually inform the implementation of the intervention. Another fieldwork task that can be used is a media portrayal of the research purpose, whereby we get non-academic stakeholders to gather printed media images, such as newspapers and magazines, which convey the purpose of the process. So in my case study, the purpose of the process was reducing sensory behavior in older adults. We got the stakeholders to bring in printed media images of sitting, and this was used as a discussion tool. So using visual tools and using visual aids as discussion tools can actually enhance the effectiveness of stakeholders and improve communication between them. We also have interactions with non-academic stakeholders outside of the research group. And this is when stakeholders informally discuss process topics with outside stakeholders. This can help provide a fresh perspective on the topic and enhance ideas, as this is essentially an informal form of snowball sampling, which can help increase the generalizability of findings. Principle 5, evaluation. As I mentioned previously, we can divide evaluation really into two components. So 5A, which is evaluating the process, and 5B, evaluating the effectiveness of the outcome. Evaluation of the process. So did the process produce a valid outcome? There are a few things that we can do to test this. The first and most obvious one is member checking. Member checking throughout, member checking all discussion points, any notes that are taken, to ensure that everything that's produced is a true reflection of the stakeholders' opinions and perspectives. We also have respondent validation, which is particularly useful when developing a prototype of what the final intervention may look like, if that's appropriate. And the stakeholders can then provide feedback on that prototype, whether this was actually what they thought it was going to be like or not, and it helps refine it. We can also measure satisfaction and ownership of the stakeholders. So ownership can be simply measured by retention rates and dropout rates. So the more people that drop out, it's probably less likely that they're feeling ownership as being part of the research group. We can also hand out evaluation questionnaires, and some constructs of interest may include satisfaction of engagement, feedback on the developed outcome, perceived skill development, and perceived knowledge development. So what did the non-academic and indeed academic stakeholders actually get out of being part of this research? Principle 5B, evaluation of the outcome. So is it actually effective? Now, because outcomes will not necessarily be theory-driven, then logic models are often useful to develop to explain the mechanism of the intervention. So this is a logic model that I created for case 1 in GCU, and logic models are particularly important to help delineate the complexities of interventions into a simple linear mode of what the intervention might look like and how it actually works. When we're testing the effectiveness of these collaboratively developed solutions, there are a couple of steps to this. So the first step is to understand whether it's effective at a local level or not. And there are a couple of things we can do for this. So we could run a small randomized control trial versus standard care, or we could run a small randomized control trial versus a top-down outcome. If this shows effect at a local level, we can then scale this up to a population level to understand if it still is effective then. So again, there are a couple of ways that we can do this. The first may be to run a nationwide randomized control trial versus a similar top-down intervention. Or another way that we can do this is actually by meta-analyzing multiple localized randomized control trials, and from that deriving population-level inference. This slide I do not expect you all to read. This is simply showing you that we have also come up with reporting guidelines, which can be useful for instigators of these collaborative research projects, and it gives different sections that these instigators should think about when looking to effectively engage non-academic stakeholders in the research process. This again will be available in the manuscript once we have it published. Now let's talk about scaling. As I mentioned before, participatory methodologies commonly result in localized solutions, and therefore there is a big tension about how to derive population level inference from these localized solutions. Well, we have actually developed 3 scaling models about how we can achieve this. So the first one is a distributed model, which our colleagues in Ghent University have done, whereby multiple localized research groups develop multiple localized interventions. And these can all then be meta-analysed, the findings from which can be meta-analysed, from which to derive population-level inference. We have B, which is a generalizable model, which is what I did in the Grandstand research group, whereby one local group developed one localized solution, which in that mode can actually be scalable and be completely tailored to end users' context and circumstances. And then we also have C, which is a cascade model, which is one localized intervention is developed by one localized group and is subsequently transported to other localized groups and adapted to ensure local relevance. Some directions for future research. We believe that the Produces framework is a really useful way to help guide the research process when looking to engage non-academic stakeholders in research. And the good thing about this framework is that it can really be used to target any health behavior and any target population, as long as the purpose is looking to, really effectively engage the non-academic stakeholders. So to conclude, engaging non-academic stakeholders in research is being increasingly advocated. Utilizing participatory methodologies may result in more effective interventions and improve end user satisfaction. However, we have very little evidence showing or assessing whether these are effective or not. But by using the Produces framework, this can help guide the process and improve the consistency of reporting these research processes. So thank you very much for listening to me. These are my contact details. So if you have any questions that I'm unable to answer during the Q&A that we have, then please get in touch with me and I will be happy to answer them for you if I can't do it today. And thank you all once again for your time, and I look forward to your questions.
Great, thank you so much, Callum. That was fantastic. Just to remind you, if you have any questions, if you could just write them in the Q&A section of Zoom. But I have a couple of questions, if that's okay.
Yeah, absolutely, fire on.
That was fantastic, and it just got my brain thinking of so many different things. And I guess I just want to confirm first that the Produces, which I really liked, that's actually not published at the moment, but it's in the process.
Yes, it's currently in press, so we would be hoping to have that published in the very near future, and when it is, I will be sure to let you know about it.
Perfect. And the scaling models, again, was that within the Produces paper as well too?
Yes, absolutely. So from when we were talking about how to effectively engage non-academics in the research process, then this is something, all of that information has actually been delineated in the principles paper. I will also be talking about that a little bit at ISBNPA in June as well. So yeah, look out for that coming out hopefully shortly.
Perfect. I have a question that, and I know that this was not the intention of, first of all, I really liked the model and how you were engaging stakeholders to create the intervention, but I couldn't help but think in the Grandstand project, did you actually look at the end users' physical activity and sedentary behavior? So, I mean, I know you can look at perceptions, but it's almost like it's a stealth intervention, really, in the sense that it is participatory, and we're working with our key stakeholders, but you're actually delivering an intervention?
Yeah, that's a really fantastic question, Maureen. When we initially conducted our research with the Grandstand research group, the purpose of that research was to understand whether co-creation is a feasible approach to developing interventions, which it seems to be. But you're absolutely right. On reflection of that process, because the end users were so engaged, it's likely that their behavior actually changed over time. And this is something that I'm really keen to do in the future, is to run a similar co-creation in the future, but to simply objectively measure the participants' physical activity or sensory behavior at the beginning of the process, and maybe during the middle, and then at the end, to see if simply being part of that group changes their behavior. We got a lot of anecdotal evidence saying that they had been incorporating some of the strategies that we developed into their own daily routine. And again, that paper is also currently under review, so it should be coming out shortly. But we didn't quantify this information, and I feel if I could go back and do it again, and it's something I will certainly do in my next co-creation project, will be to objectively quantify their behavior in some way.
Fantastic. Great. Well, we have a question coming in. How easy was it to recruit participants and to reflect the end user groups you were hoping for?
We didn't find participation as too much of an issue. The reason for that is because we recruited through an older adult research database that we have in the university. So most of the older adults that we actually engaged in the research process are familiar with research and have been part of other research projects in the past. Now, of course, this can lead to sources of bias where they might not be the typical older adult group, but yet they did contain a wide variety of self-reported sedentary time, medication, and number of falls in the past 12 months. So we found it relatively easy to recruit that group, and we actually found we had 100% retention rate throughout the 9-month period. The older adults that we engaged were really, really keen to take part in the process, and I think that is attributed to some of the principles that we have and delineated in this paper is actually what we implemented during the process. So things like branding the group, making sure everyone realized that we're all have an equal status. I feel all that was really important to the success of the research. And even talking to the end users themselves, they expressed that this research project was a lot more interesting than some of the other research projects that they had been a part of, because, to quote one of them, you weren't just a guinea pig, but you were actively engaged in the process, and their opinions led to the eventual outcome.
That's great. Thank you. Thank you for the question. That actually makes me also wonder, and you may have said this, but who actually ran the sessions? And had you ever envisioned the actual stakeholders as running the sessions, or is that what you did?
To begin with, the academic stakeholders guided the sessions, but we were simply there. The role of the academics during this collaborative process is simply to input the governance procedures, so to make sure everyone is aware of their rights and responsibilities, and to make sure that the process is scientific. As the process went on, it was quite common for the non-academic stakeholders to actually lead the research and identify what were the issues that they wanted to tackle. So in the beginning, whilst ownership was taking its time to manifest in the group, some of the activities were maybe more academic researchers led, but then that transitioned the more workshops that we had together. And that's also an important point, is that there needs to be a balance between how many sessions you actually hold to ensure that ownership is manifested in the group, and therefore the group can take the lead on many of the discussion activities that you have. But then you don't want too many and to overburden the end users or non-academic stakeholders, and then they kind of fall off. So it's a fine balancing act, but yeah, certainly from the first couple of sessions onwards, it was predominantly led by the non-academic stakeholders.
Great, thanks. If you have any questions, please use the Q&A section of Zoom. But Callum, I just was wondering, do you think that the ratio of academics to non-academic stakeholders may make may change the research process?
Yeah, I think that's a good point. I feel like I said, the role of the academics are really to input the governance into place and to help guide the process to ensure that it's scientific. There is a danger that if there are too many academic stakeholders involved, that they can take over the research process. So in some instances, depending if it's a particularly complex health problem that we're trying to target, it may be necessary for multiple academics to be involved. But instigators of these research projects really need to be mindful that too many academic stakeholders may mean that the process is slightly jeopardized, and it's just something that you need to be, you're absolutely right, you need to be mindful of it. So our ratios were typically, so we had 4 academic researchers, but they didn't always, not all 4 of them attended at the same time. So it was commonly maybe about 1 academic researcher to about 4 or 5 non-academic stakeholders.
Great. And great, thank you so much. There's a couple of questions that are coming in. So who develops the evaluation framework, the end users or the researchers?
So the evaluation framework that we developed was based on all of our experiences from actually engaging in this in the research. So, for example, in my case study, all of the non-academic stakeholders really wanted our intervention to be tested. They really wanted to roll it out there, and they wanted to see if it was effective. They wanted to start giving it to people. But one of the things that we did in upskilling them was making them understand that we would have to put this into some sort of formal trial to understand if it does actually change the behavior. So from that, the non-academic stakeholders felt it was very strong that this should be formally tested for effectiveness. And I mean, in terms of how we actually came to our evaluation framework, like I said, this came predominantly from our reflection from all 4 of the case studies and all of our experiences combined.
Great, thanks. Got lots of questions. Thank you so much. So another question is, did you consider using peer methods to train peers from the communities to run future interventions themselves?
Yeah, we did. That is something that we spoke about and thought would be something that would be really good to do. But because this was part of my PhD project, I didn't have time to implement that fully. But that is something that we did discuss, this idea about maybe peer mentoring and peer methods. But it's not something that we've not managed to fully explore yet. If I can get some grant funding in, that sort of thing will be what I would look to investigate a little bit further.
Great, thank you. The next question is there evidence to support an optimal time for these processes?
As far as I'm aware, no, there isn't, because each process is going to be unique. As I said before, it's really dependent on the end user group that you've got. It's dependent on the amount of time and resources that you have available. As far as I'm aware, there isn't really any. The best that we can do is draw on our experiences. And the biggest problem with the principles and recommendations that we've delineated is that there's simply not enough published evidence in the literature to synthesize that all together. And we'll see from the literature review that I did from Tricia Greenhall, which is we've engaged end users for decades now, and there's still very, very little evidence of effectiveness. So I guess it depends. It's kind of trial and error, but the guidance that we put in there is, it can take, I don't know, maybe 3 to 4. The amount of time that ours took on average, the actual amount of time was maybe about 20 hours, but this can be really, really condensed, or it can be spread out over a period of time. It just really depends on the resources and time that you have available.
Great, thanks, Callum. So the next question, is it possible to translate the PM to the daily practice? I ask as a physio and seniors trainer in falls prevention.
Sorry, can you repeat that?
Yeah, so is it possible to translate participatory methods to daily practice? So from a clinical practice perspective, I ask as a physio and seniors trainer in falls prevention.
Okay, well, I guess so. I mean, primary healthcare is meant to be very much patient-centered and should be all about the patient's needs. So, yeah, I believe a lot of the principles that we've delineated could be directly applied to that setting, whereby it should be very much end user led, whereby they explore the options that they believe are going to be best for them. But again, the physios or whatever your profession is can help kind of guide that process. So I think some of the examples that we've used here could be quite useful to translate into that setting. But again, it's not something that we have in our cases have reflected much on.
Right. I guess I'm thinking about, what about falls prevention group-based programs? I mean, maybe you could convene a series, a group of stakeholders who could help inform what a future program might look like.
Yeah, absolutely. I think one of the problems that we have just now is that if we are developing a falls prevention program or any sort of program that's top down, they traditionally result in a large disruption in the individual's routine, which we know can be very effective in the short term, but often will not be sustainable. And by actively engaging the non-academic stakeholders in that process and getting them to think about, we don't just want something that's effective and suits you, but it can also be used longitudinally. Their opinions and perspectives are really pivotal to this, and I feel this is one of the particular strengths about engaging end users in the research, is we can have more tailored outcomes that can hopefully be more sustainable over time, which is again something that we struggle to show.
That's right. You kind of touched on this a little bit, just around participants and potential barriers, but the question is, I really like how you approached engaging participants and inviting their opinions on what works well, doesn't work well. Did you experience any barriers from participants in getting them involved, and how did you address them?
So, as I mentioned before, in terms of recruitment, there wasn't much of an issue there. The biggest issue that we probably had was we were lucky in terms of my case. I'm not going to speak for the other ones, but as I said, we had a very engaged group who had participated in previous research projects before. So we know, first of all, that co-creation is feasible, and we know this group are willing to engage in it. Probably the biggest issue that we had in the beginning was that some of the end users were a bit reluctant to take part in some of the fieldwork tasks, which commonly involve discussing some topics with other end users, and that was mostly because they weren't necessarily comfortable with it, or it was in the early stages when we knew what the purpose of the project was, but we didn't know what the end goal was going to look like. And really that changed just from being part of the process. And as the process went on, the more time that we spent together and the more ownership that everyone developed and a real collective understanding about what we wanted to achieve, then that seemed to go away. But that was really the biggest issue in terms of the end user engagement that I could exemplify for you.
This is somewhat related. Could you highlight any tasks that co-creators took on in between the workshop sessions, and how was this managed and supported?
Okay, so as I said, I gave some examples of some fieldwork tasks that they did. So I would like a really good example is gathering media images of the purpose of the process. So as I mentioned before, the purpose of our process was to reduce sedentary behavior in older adults. So we got all the stakeholders to go out and take in printed images of sitting in the news and have an idea about, how is sitting actually portrayed? How is that health behavior portrayed in the media? We also got, our intervention took on an asset-based approach whereby the older adults used all the behavioural resources that they already use on a daily basis to interrupt the central behaviour. So one activity that we got them to do was actually to go out to find other older adults and discuss with them, these are a list of assets that we have to break up sedentary behaviour every day. Are there any other assets that you can maybe think of that we've not already thought of? And again, this was a form of snowball sampling. And we also had the older adults take part in things like prototyping. So we sent some of them out into a community group of more older adults with one prototype component of the intervention that we developed, and we made them give it to another group of older adults to see if it actually worked and whether it was applicable to them and maybe some changes that we had to make. So that was particularly useful because we had some changes in wording that we had to make and some changes in the actual structure, and that's not something that we would have known unless we consulted that external group. So yes, the end users had there were lots of different examples of fieldwork tasks, and again, my co-creation paper that's coming out soon will actually give a breakdown as to all the sort of the main tasks that we had in the workshops, but also some of the main tasks that they had outside the workshops as well.
Great, thank you. So another question, do you intend to publish professional guidance in addition to peer-reviewed publications and papers? That was a question I had too, actually.
Well, that would be good. I think from there we would need, what we'd like to do really first of all is to use the Producers framework as a basis for a multitude of co-creations in different health behaviours and different target groups, and that would, I guess, ultimately be the end goal. It's something in the pipeline. Absolutely, yeah. Great,
thanks. There's another question. I had this question as well too. You had a very willing and understanding population for this. Do you think you would have to adjust the process at all in applying it to more hard to reach or vulnerable populations?
I feel that the principles that we have set out will be widely applicable depending on the group that you're actually targeting. I feel it's important to note that yes, we had a population group that was keen to engage in research processes, but we didn't necessarily have a particularly active group of older adults. Well, let me rephrase. We did have an active group of older adults, but their mean sedentary time was self-reported sedentary time was very high. We also had some individuals in the group that admitted to absolutely loving being sedentary. They loved watching TV. They loved prolonged periods of sitting and didn't want to break that. So we have, to some degree, encountered that already, and those experiences that we've had have, led to the guidance that we presented here. Yeah, I mean, I guess it might need to change a little bit, but part of the co-creation process is being reactive to the stakeholder groups in it and adjusting that accordingly. But generally, as we found, it's the time involved in being in the process is one of the most important factors in terms of ownership and that sort of thing. So yeah, we would see.
So a bit of a follow-up question, this one's for me actually, is that so I hear what you're saying in terms of maybe with respect to their physical activity, but they must have actually been at a level like cognitively and motivation-wise too. So like they were at a level, and I guess my question is, do you think that they necessarily represent the spectrum of people who are engaged in prolonged sedentary behavior?
Well, I mean, the first thing is that we don't know, because we didn't go as far to measure that. As I said, we did have some self-report sedentary behavior, and their self-report sedentary behavior was very high. Yep. And yeah, it's something that we don't actually know. So what was the first part of your comment again?
Well, it just around cognition, health literacy, and just like psychosocial processes in terms of this was as a group who was motivated to be involved.
Yeah, absolutely. One of the key things about co-creation though is that there has to be everyone who's involved in it has to be willing to actually invest themselves in the process to make it happen. So there does need to be some sort of motivation there in the first place. There was a second point that I was going to say, and I just got sidetracked, so I can't remember what it is. But if I remember it, I'll bring it up again.
That's great. Thanks. Are there any more questions from anybody else?
Oh, sorry. Yeah, the one point that I was going to just reiterate again back to the group that we did was because really there's been no guidance about how to do, particularly co-creation is what we did. So because of that, we very much had a convenient sample of community and older adults. But now that we know that co-creation is feasible, and now that we have drawn on several cases and got these guidelines, we can actually use these and maybe implement some other perhaps challenging groups. So one group you mentioned cognitively, one group that I would be really interested to do co-creation would be dementia sufferers, and part of the recruitment process is that you want a very representative group. So you may have some individuals that engage that are have very severe dementia, and then some maybe just have it a little bit more mild. And then this can help us understand how this process actually works with perhaps more challenging health behaviors and in more challenging populations. So yeah, it's definitely something that will be really interesting to explore, kind of going forward and taking this into other health areas.
Yeah, as I said, I really enjoyed listening to your talk and look forward to reading the paper. As a researcher, you mentioned about that some funding agencies are supportive, but in general, are research agencies, do you find supportive of actually this process, which we know is really important, but oftentimes funding agencies don't see the fact that it takes time to do this type of work?
Yeah, I think it is end user engagement is being increasingly advocated, but it is still, I think it is still difficult to get funding for that. And one of the reasons, or one of the discussions in the literature, is because there is such little evidence of effectiveness, and there is such little evidence of governance about how to actually guide this process, then research bodies may be less inclined to put money into an area which is very time and labor intensive, particularly when we have very little evidence showing that engaging non-academic stakeholders is effective. So we have a lot of information saying that it's great, it improves tailoring, but less information on the actual hard numbers showing that behaviors changed. And I believe until we get this, then it is going to be difficult. I know in countries like in Scandinavia, whereby co-creation that's really where it was born. They have it's much higher success rate than it maybe is here in the UK. But I feel this is one of the really useful things about this Producers framework, is that if we can be engaging non-academic stakeholders, measuring similar constructs and conducting these processes in a similar way, it's going to be much easier to synthesize this evidence and really build a rationale for getting these initiatives supported. But first of all, we need to check if they're effective or not, which is the big thing lacking in the literature currently.
Yeah, and as I say, I mean, there is support for here in Canada. I was just more curious in other places. Yeah. So, are there any other questions? No, we're almost at the end of our session. I only have about 5 minutes or so. So Callum, any final concluding remarks?
No, just thank you everyone for tuning in, and thank you for your very interesting questions. There are so many things that have been asked that I'm really keen to do, that I hope I'm going to get to at some point. So yeah, I think it's a really exciting area. I think it's an area that's growing in terms of attention, and I think there's a real need for it. So yeah, it's an exciting research area to be part of, and yeah, I'll welcome any contact with anyone who's looking to instigate similar processes anywhere. Give me a shout. You've got my details, and yeah, that's really it.
Fantastic. Well, thank you so much. I really appreciate your time and the presentation. It was excellent. I really appreciate it. And also wanted to say thank you to Antonio and ISBNPA for giving us this opportunity to host this, I guess, our first Aging SIG webinar. So yeah, thank you very much.
Thank you, Maureen and Callum. in the name of ISBNPA. Okay, so bye-bye.
Thanks. Bye-bye.
Bye.